Welcome to the Rationale for Training by Belinda Contreras, ED 5803. The type of training, this is a self-paced training that is on our UKG learning management system. This training will last approximately 20 minutes and will have assessments throughout. This training was developed to meet the needs of group living staff. A task analysis was conducted that determined that staff needed de-escalation training. Staff sometimes struggle with the best course of action in a situation. As they build their skills and add tools to their toolbox, they gain confidence. This confidence helps them to improve their youth interactions, and subsequently, they are better able to deal with the situations that impact youth. The needs analysis was conducted using surveys, audits, focus groups, feedback from managers and supervisors. The target audience is direct care workers. The learners are any staff that is working directly with the youth. Direct care staff are the most common learners. However, other departments also work with the youth. Our responsibility is to ensure that all staff have the appropriate training when working with the youth population. Job analysis. The primary job description of a coach counselor, primary responsibilities of coach counselor are to provide safety and around-the-clock supervision of at-risk youth. Coach counselors provide for each student's physical, personal, health needs through individual counseling and behavioral, social, physical, and educational skill development. Coach counselors provide an atmosphere that supports the student's needs, monitors and documents students' behaviors and activities, and participate and assist with educational, social, athletic, and recreational activities. So our instructional goal, learners will implement de-escalation strategies to initiate a situation in 100% of all encounters with students. Learners will evaluate the effectiveness of their strategies and explain which strategies are most effective with students 100% of the time for each interaction. So the task analysis was based on the goal of intervening when a student's behavior is beginning to escalate and the breakdown of the topic as staff work with youth. It is important for staff to understand how to evaluate the behavior and learn to make decisions on what to do next. Staff need to be able to recognize a change in youth behavior and provide an appropriate response to engage the youth to help the youth regulate their behavior. So evaluating the student's behavior, paying attention to body language, facial expressions, movement, balled fists, changes in skin color, changes in normal behavior. Is the student withdrawn? Are they sad? Are they angry? What is going on with that youth? Risk and protective factors. Risk factors are those things that will influence youth to perform antisocial behavior. Protective factors are those things that will keep a youth from participating in that antisocial behavior. Task 3, treatment plans. Staff should know the treatment plans for their youth. This training will cover generic treatment plans and why they are important for youth. And also understand the interventions like a timeout, stabilization, safety plan, and that those plans are individualized for each youth, and that everybody is involved in making those plans, from group living, their home people, therapists, all of those individuals are involved in that plan. Task 4, staff intervention. Staff need to intervene as soon as they notice a change in behavior. It is important that they avoid power struggles and they do not take things personally. Multimedia was utilized throughout the design of this training. Staff find it engaging and can connect better with the material. Videos of different types are used to engage the learners. Graphics and other digital technology are interspersed throughout the presentation. Multiple choice assessments and scenarios are used throughout the training, and case studies are also used to evaluate the learning. And at the conclusion of a training, of the training, an evaluation form will be provided to each learner that they will complete on the learning management system, and then that concludes the training.